Hey y'all, just now leaving work. It is a beautiful day outside. It's about time because it's been winter since October, so finally glad to be able to get some sun. So I want to talk to you guys today about the approach to neurology presentations. So when we get consulted in the hospital or when we get consulted in the clinic as a neurologist, we have an approach. And once we hear the patient's story and we're coming up with the assessment, we ask ourselves, number one, is this a neurological is this a neurological clinical symptom? Does it fit a neurological pattern, or is it non-neurological? Because if it's not neurological, then you're pretty much done with your workup. But first question, is this neurological in nature? And you'll be able to figure that out with experience. Number two, if it is neurological, where does it localize? And that is a very key question that we always ask ourselves as neurologists, and sometimes trainees tend to forget to ask themselves that question. Is it neurological, and where does it localize? Does it localize to the CNS, the PNS? And we can go through localization in another video. Third question you want to ask yourself, if it does localize, then you want to base your differential on the localization, whether it's hyperacute, acute, subacute, or chronic. If you kind of know the timing of the symptoms, that can help you with your differential. And then after you come with a differential, then you talk about what kind of workup do you need to help figure out which of your differential diagnosis is truly the diagnosis at hand. Then you follow up and you keep looking at the results until you have a differential diagnosis, or until you have an answer to your differential diagnosis. And with that, you can then come up with possible treatments for the patient. So to recap, first question, is it neurological? Second, if so, where does it localize? Third, based on your localization and the timing of the symptoms and the clinical presentation and the neurological exam, what is your differential diagnosis? And then number four, you order what test you want to order to help with your differential diagnosis. Follow up on the orders, treat, and if patient is not improving, you go back to your differential and order more tests. With that, happy studying, happy learning neurology, and I will see you at the next video. And be sure to join my study group.